What is a colectomy surgery for colorectal cancer? Imagine your colon as a long, winding tube that helps digest food and absorb nutrients. When cancer develops in this part of the body, doctors often recommend surgery to remove the affected area. That surgery is called a colectomy. It involves taking out part of or the entire colon to eliminate the cancer and prevent it from spreading further. The main goal is to remove all cancerous tissue and give the patient the best chance for recovery. There are different types of colectomy surgeries depending on how much of the colon needs to be removed. A partial or segmental colectomy targets just the part of the colon with the tumor. For example, if the cancer is in the right side of the colon, a right hemicolectomy may be performed. If it's on the left, a left hemicolectomy might be the choice. When the cancer is widespread, or in cases of certain genetic conditions, a total colectomy may be necessary, removing the entire colon. During the operation, the surgeon carefully removes the cancerous segment of the colon. After removal, they usually reconnect the remaining healthy parts of the bowel to restore normal digestion. This process is called an anastomosis. Sometimes, reconnecting the bowel isn't possible right away, and the surgeon might create a temporary or permanent opening called a colostomy or ileostomy. This opening allows waste to exit the body into a bag attached to the abdomen, which can be temporary or permanent depending on the situation. Colectomy can be performed in different ways. The traditional method involves a large open incision in the abdomen, giving the surgeon direct access to the colon. More often now, surgeons use minimally invasive techniques like laparoscopy, which involves small incisions, specialized instruments, and a camera. This approach often results in less pain, shorter hospital stays, and faster recovery times. This surgery is a key treatment for colorectal cancer because it directly removes the tumor and reduces the risk of the cancer spreading. It can also help relieving symptoms like bleeding, pain, or bowel obstruction caused by the tumor. However, like all surgeries, colectomy carries some risks. These include infection, bleeding, leakage at the site where the bowel is reconnected, and reactions to anesthesia. Before surgery, patients usually undergo evaluations such as colonoscopy, imaging scans, and blood tests. These help plan the procedure and assess overall health. Recovery depends on the type of surgery, the patient's health, and how well they follow post-operative care instructions. In summary, a colectomy for colorectal cancer is a well-established surgical treatment that involves removing the cancer-affected part of the colon. The goal is to eliminate the tumor, prevent further spread, and restore normal bowel function whenever possible. The specific approach depends on the tumor's size, location, and the patient's overall health. It's always important to discuss treatment options with a healthcare professional to determine the best plan for each individual.